And what are your thoughts on the operator being the anesthesiologist, meaning the surgeon who's providing the surgery is also providing the anesthesia?
That's way too much responsibility. You know, there are lots of things that, you know, the surgeon needs to stay focused on the case, and it needs to be an anesthesiologist focused on the patient, the hemodynamics. I mean, there's lots of things that can transpire during the case. You have to observe the patient, their temperature, the temperature in the room, all the monitoring that's going on during the procedure. And it takes the surgeon away from what he's there to do.
What he's trying to do.
Right.
Yeah, absolutely. Yeah, and you know, and that's what I've found. You know, I do have my permit to provide anesthesia, but my preference is to focus on the patient. You know, let me do my job and have, you know, my anesthesiologist maintain, manage, and you know, and of course the entire room is watching the monitor, and if there's anything that happens, we can address it right away. But it makes it go so much smoother. I can provide a much better end result because of you and because of how well you do your job.
Well, you're afforded the ability to work efficiently and expeditiously, whereas during a sedation case, you know, if the patient's a little light, you may have to wait, or you know, or if there's some coughing or whatnot, you know, that interrupts your flow.
Right. So. Absolutely. You know, and I'll have patients, you know, when they come in for a first consultation, you know, they're concerned about the cost of the anesthesia. But in reality, that cost is absorbed because the case goes so much smoother, and I'm able to work so much more efficiently, and we don't have to do 3 or 4, 5 sessions under sedation. So in reality, I would say it's even more economical to do it this way because we are so much more efficient at it when we're working.
Right.